about us. Think about you leaving.
Oh, real quick. What's up, everybody? I see Roel is in both places. D. Lynn, Logan from Colorado. Hello. We're going to let a few people come in here. We're going to get to every question tonight. Thank you guys in advance for being here. We're going to let a few more people come in. Ben C., I love you, brother. I love you. I got to respond to your beautiful text. Thank you so much. I love you, man. Mama T, what's up? Great to see everybody. Hope everybody's doing wonderful. We're going to let a few more people come in. Oh, shoot. Okay, we're not on Facebook. That's what's happening. Okay. Let me see what to do here. All right, guys, hold on with me. Hold on. Foxy Moxie, what's up? Miss Farrell, hello. Sorry, guys, I'm connecting to Facebook real quick. I see we're not there. Okay, let's see. I know. Roel, it is. All right, guys, we're getting ready to answer questions. All right, let's see if I can get us live on Facebook. All right. Tom, my brother, can you check it and see if I'm on Facebook yet? I'm not on Facebook, I don't think. Rachel, what's up? Trying to get on Facebook. Mother T. All right, now we should be live. All right. Crisis averted. All right, we got some Facebook people in here. Let me know if you're on Facebook. Not seeing anybody yet. All right, thank you, Foxy Moxie. It's kind of cold here, Roel. It's kind of cold right now. I don't know. I don't know. I think the high is going to be 65 this week, roundabout. All right, let's see here. If I have anybody on Facebook, will you let me know you're here? Let me know on Facebook if you're with me. Yes. Rachel in Maryland on Facebook. Ben C on Facebook. Thank you, guys. All right. Now we're on Facebook. All right. Mama T, what's going on? We're answering questions tonight. We're back. Lisa, what's up? Great to see you. I hope you're doing wonderful. All right, real quick, I'm going to put this up here for those who have not yet seen. New episode of the Common Sense MD is out. The Secret to Pain-Free Movement with Dr. Scott Fitzpatrick, one of our favorite acupuncturists here in East Tennessee. Talks about more things you can do for your fascia. Thank you in advance, Dr. Fitzpatrick, for doing that episode. Brand new episode of Explain This is also up, talking about the relationship between testosterone replacement and sleep apnea. The star of the show, Robin Riddle, kind of goes over those studies. If anyone's ever been concerned around testosterone and sleep apnea, this is a must-watch Explain This episode. Thank you to Robin for doing that episode for us. Steve, what's going on, my brother? Great to see you. Danny, what's up? Oh, D. Lynn, I'm so sorry. Man, D. Lynn, I am so sorry. That is heartbreaking. Goodness. Well, you are in our thoughts. You're in all of our thoughts here. For those who can't see on Facebook, D. Lynn's husband has passed away. It seems a week or so ago, a little over a week ago. Shoot, D. Lynn, I'm so sorry. We are thinking about you and praying for you. Thank you for being here tonight. And as always, if you need anything, make sure you shoot me an email, please. Let's see here. Who else is in the building tonight? Who else is with us? Thank you for those comments, Foxy Moxie. Thank you, Tom. We're thinking about you, D. Lynn. Thinking about you. Thank you, Mama T. Montana, I love you. So good to see you. So good to see you. I miss you. Mama T, I see your questions. Thank you. Great question. Great question. Deanna, what's up? All right, we're going to get to some questions here. Samantha, what's going on? It's great to see you. So proud of the Abingdon office. You guys are doing amazing. If you guys don't know, we have an office in Abingdon now. Go check out Samantha. She's doing amazing work. Tabitha from the Kingsport office, I love you. Great to see you. Thank you for being here tonight. Let's see here. Who else we got? We got anybody else tonight? Great to see everybody. Montana, I love you. Say hi to the family for us, please. We love you. All right, Tracy. Tracy, what's up? Great to see you. Tracy, aka Casey. Doing amazing over there in the Abingdon office. So good to get to talk with you every day. Angie, what's going on? So good to see you. I miss you. I need to get you. Actually, you'll see me tomorrow morning. You'll see me tomorrow morning, Angie. All right, let's go. Let's see who else is in the building. Say hello if you're a first timer. If you're a first time in here, Danny. Yeah. I am as soon as it gets below 50, I am what's the brand? What's one of those puffy coat brands? I'm a puffy coat person. 50 and below. 50 and below. Edna, hello. Hope you're doing well. Hope your knee's doing okay. Julie, good day, mate. Good day to you. We're taking questions, guys. Thank y'all for being with me tonight. We're going to be doing this for the next hour or so, answering all your health and wellness questions. I got a progesterone question that came in throughout the week. Thank you in advance for that. Real quick, if we have anybody in the Tri-Cities area, we're doing an aesthetic event tomorrow. We're running specials. This is with my sister, Kelly Rogers, talking about, we're talking chemical peels, sunscreens, oil therapy. We're doing a special on. I'm going to be there to say hello, so please stop by if you're in the area. That is tomorrow, October 22nd, 4 to 6 p.m. Hope you guys can make it. Those of you, oh, there you are.
Hey, man, snuck in on you.
Oh, we got to fix this. There we go. Come on. We got Brookhaven with class.
Yeah.
With class.
I'm wearing my hat lower than yours.
You trying to hide?
We got the same hat.
We got the same hat?
Yeah.
You look sharp.
I just had a great Brookhaven burger. That was
I did too. Unbelievable. As always.
And I grilled it.
Shout out Brookhaven
Jake.
Farms. I got to see Jake today. It's always a pleasure. Let me see here.
Amazing.
Sorry guys, I'm gonna have to April, what's going on? Great to see you. Your Instagram handle always throws me for a loop. April, so good to see you. Let me see if I can get this out. There we go. All right, we're answering questions, guys, over there on Instagram. We're answering questions. If you have questions, go ahead and put them in the comments. Hello, podcast. Teresa, hello. Great to see you. Barbara, hello. Christy, what's up? Shelby's mom's in the building. I love it. All right, guys, we got a great group tonight. If you have questions for Doc, go ahead and put them in the comments. Same goes to everybody here on Instagram. Put them in the comments if you have a question for Dr. Rogers. Mike's in the building. What's up, Mike? Great to see you. Let me know if I got any first timers in here. I want to give you a quick shout out and want to thank you for being with us tonight on the show. Real quick, we're going to get to a question that came in, I believe yesterday over email. Question is, I'm taking testosterone and progesterone 200 milligrams for anxiety and sleep for perimenopause. I only take progesterone days 14 through 28 of cycle, but don't have a 28-day cycle. I love my progesterone and want it every night as it makes me feel better all around. Can you explain why one would take every night compared to day 14 to 28 of cycle during perimenopause? I hope I correctly read that.
Yeah. First of all, yeah, you can take your progesterone every night. Sometimes we cycle progesterone to try to mimic the way your cycle normally works. The first half of the cycle is an estrogenic phase, and then the second half, estrogen goes down, progesterone goes up. So a lot of women, say in their mid to late 40s, when their progesterone drops off, which usually is the first hormone to drop off, will want to mimic that regular cycle and have a period. Because when you stop the progesterone, boom, you have a period. But really, you can, hopefully you're not trying to get pregnant. That's another way you could get pregnant, is by cycling progesterone in like that. But to be honest with you, if you're almost in full-blown menopause and the progesterone's helping you so much, I just tell you to take it every night. So it's not a big deal. And you probably, your period's going to go away and probably stop anyway. But progesterone is, to me, maybe even the most important women's hormone, because it kind of balances out estrogen and also helps you relax, helps you sleep, helps you keep weight off. There's a lot of protective effects for breast and uterus. So yeah, so that's one way we do when we get somebody early on and they still have estrogen, and they just need to, that last half of the cycle, they may have PMS or just really low progesterone levels, and they suffer from it. But at that point, if you came into my office, I would tell you to take it every night.
Such a great question. I know that applies to so many different people. We've been talking Robin Riddle did a couple of Explain This episodes around women's hormones and how to kind of work with your cycle. So thank you so much for that question. I hope that helps a few people tonight. Real quick, I see Jake's over here. Jake, what's going on, brother? It was great to see you today. I see Tony Wilson's in here. Tony, so good to see you. I see he's a Vol fan. I don't know if anyone else is worried about Tony Vitello. I'm a little worried. I hope he stays. So we'll see. It's not done yet, so we still have a shot with Tony Vitello.
The San Francisco Giants have been my favorite baseball team since I was 8 years old. I love the Giants. You've seen my shirts, my Willie Mays posters, and baseball cards. I'm a huge San Francisco Giant fan. So if Tony's going to leave, I hope he goes to the Giants.
I will say,
what he wants to do.
I will say, I'm a Vol forever, Vol for life. If Tony goes to San Francisco Giants, I will be a San Francisco Giants fan. I love Tony V. All right, let's get moving to the questions. I see Vicky's a first timer. Vicky, welcome. We're taking health and wellness questions. We do this every Tuesday night, 7 to 8. If anyone has questions, go ahead and put them in the comments. We're going to get to the live portion of the show right here. I'm looking at Instagram as well. So if you have questions, put them in the comments. I saw Mama T, I think, had one. I'm going to start over here with Logan from Colorado. Tell us where in Colorado, Logan. I'm a huge fan of the state. So let me know where you're at. Does methylene blue affect gut bacteria? Who does Doc Rogers most recommend? For health insurance. That's a great question. Okay. Does methylene blue affect gut bacteria?
Hasn't affected mine. It shouldn't. If you take it and you notice something's off with your gut, you'll know maybe it is. But I take it myself, and I've told a lot of people about it, and a lot of my patients take it, and I don't think I've had anybody complain about it.
I haven't heard
as far as that goes. So I don't think it's going to bother your gut bacteria. If it did, it'd probably affect the bad ones more than it does the good ones. So there's always that balance between the good and the bad bacteria in your gut. So I would say it probably has a positive effect because it's definitely antiviral, antibacterial, antifungal. It's just a great antiparasitic. If you look at my podcast on methylene blue from a year or two ago,
Yeah, you've done 2 of them.
it's a really interesting compound. Beneficial in a lot of ways.
I wish I had the NeuroPro up here. I take it every day.
I've got some downstairs.
Yeah, I like to show it, but it's has vitamin C in it with that, which I know you recommend. Vitamin C with the methylene blue.
It's kind of easier to take than the drops. But
Yeah.
you can titrate the drops if you want to go lower, but it's still not a high dose. Just like anything, you could overdo anything. So I hope that helps.
Yeah.
Try it if you need it. Health insurance. It just depends on your age. What I would recommend, I can't put a recommendation for Blue Cross or United. I will tell you, United Healthcare seems to be the most corrupt one out there. They're kind of fraudulent in a lot of ways. Look what they've done with Medicare Advantage. It's totally fraudulent. What I would do is get maybe even, like Farmers insurance. They seem to be reasonable in price. But what I would do, my advice to you, there's many policies, check and see what it covers. And if you're healthy in any form, then get a high deductible medical savings account and use your money where you want to use it. And if you don't use it, it's almost like a pension plan. You can save it. So I think any high deductible medical savings account is what I would go for.
For healthy individuals.
For healthy individuals, if you've got just a crap load of medical problems and have to take all kinds of expensive medicines, you may have to go for something else. There's another program called MediShare that a lot of my patients have that is really inexpensive. And I think it provides you up to $1 million in coverage. And a lot of people tend to like that one that are self-employed. And it's amazing. A lot of people stick with their jobs instead of retiring or moving on to another job just to keep their insurance.
They do.
But just get a high deductible medical savings account. Farmers Bureau, I think for some reason it comes to mind. They may have a pretty good one, but just shop around a lot and don't go for the gimmicks like dental, eye care, and all that. Just go. You want insurance for disaster, not for everyday colds and things like that. I don't know when it became the premise of insurance companies to make you think that they're going to pay for everything, because they're not. And
Even if you have a pretty big premium, which is unfortunate, you can be paying a lot each month and it's still not cover a ton.
Oh, I know.
You're still gonna have to pay for, a certain amount for co-pays. But I love the advice around the HSA. Utilize the a plan that has an HSA if you can. Is there any questions? Like, say Logan is trying to choose a different plan. Is there any questions to ask or things to look for? Just like what it covers? Anything big?
Yeah, like if you're out of state, you get coverage.
Oh, yeah.
If you're traveling, what are the co-pays? Of course, what your deductible is. Is it a true HSA? What medications do they cover and don't cover? Now with the GLP-1s, nobody's hardly covering them. So
Right.
Unless you're diabetic. So there's a lot of questions. Insurance companies is a hard business right now, and it's geared for profit. In my practice, of course, I don't take medical insurance. You can use your insurance for anything we do, like labs, if we order x-rays, all that. But for office visits, we don't take insurance. That's why I see 12 patients a day instead of 50 like I used to see.
Right.
It's just better medicine. So find a doctor that either does direct care or fee for service like I do.
And takes HSAs.
And takes HSAs. You can
Yeah.
use that for a guy like me. And just keep yourself healthy and concentrate on preventive medicine, not getting on every medicine in the book, because they don't have time to really find out the root cause of your problem. So I hope that helps you.
Yeah, it's a great question, Logan. And I think the big thing is being thoughtful around it. And I'll ask, we got quite a few people here tonight. If there's anybody who does like a certain type of insurance, program, plan, whatever has worked well for you, put it in the comments, let us know what's working for you. I'm interested. But with the HSA, it's tax deductible going in and tax free coming out. So you kind of got both sides of the coin there. So I think it's a great deal. I don't think people know enough about HSAs, so we're huge fans. Logan, thank you for the question. Such a great question. I see Smokey Mac's in here. Smokey Mac, welcome. Thank you for being here. Jasmine, my SD Bessie's in here. So good to see you. Kelsey, what's going on? It's great to see you. I'm going to see you hopefully this week over there in Abingdon. All right, let's get moving here, guys. Thank you all for the questions. I'm going to get to Mama T over here on Instagram. Mama T's asking thoughts on injections for women's hormone therapy. I know you all have talked about pellets, creams, and troches. What's your thoughts on this?
What's the thoughts about injections instead?
What's your thoughts on injections for women's hormone therapy? So we've talked about pellets, creams, and troches. It seems that she's thinking about like maybe testosterone injections.
Yeah, I mean, there are estradiol injections out there as well. I've used them a couple times. I don't tend to like to use them. But I do like T-shots in women. I mean, that's fine. We use low dose. Women seem to like it, especially if they work out all the time and are really needing something more boosting to them. And the creams may not have been effective. I would say there's no progesterone shot that I know about. And certainly you don't want the Depo-Provera shot, birth control. That's been a disaster. There's so many lawsuits out against Depo-Provera. If you took that form of birth control, you're about 2.5 times more likely to have a brain tumor, meningioma. That's just now coming out. So there's thousands of lawsuits against the makers of Depo-Provera, which is medroxyprogesterone, which is the bad actor in any of these studies. It's not bioidentical estrogen or micronized progesterone. But in any event, so T-shots, yeah. I mean, we give low-dose T-shots to women, let them self-inject, or they come in the office. I love the T-pellet probably better than any of them because you still get a nice smooth release of the testosterone over a 4-month period. And I did several today. It just takes me, 5 minutes to put them in, 5 or 10 minutes.
Yeah.
But women seem to like those a lot if the creams aren't effective. So yeah, but no, I don't recommend the estrogen shots. Testosterone, yeah. Progesterone, which is the only really hormone that I use orally, is now you can do troches if you want both. Kind of skips that first pass metabolism through your liver. So,
what do the T-shots look like for women? Is it bi-weekly, weekly, super low dose?
Usually weekly. Some get by every 2 weeks.
Okay.
Pretty low dose.
Okay. Mama T, let me know in the comments if that helps. I'll get to your question here in just a bit, but let me know if that helps a little bit there. I'm going to go to, let's see here. Let's go to Foxy Moxie. I do have a question. I bought the NeuroPro Plus. Can you explain exactly what it does before I try it? My sister-in-law bought it too. So the NeuroPro Plus is methylene blue. It's a capsule form. Go ahead and explain that for
It's a tablet, which you can break in two. Methylene blue, again, go look at my podcast on methylene blue. I spent a lot of time talking about it. But basically, methylene blue, which has been around since the 1860s, was discovered by some German scientists who were dyeing blue jeans. And they started looking at this dye and under the microscope, like scientists tend to do, and they noticed that it differentiated the parts of a cell. Like you can see the cell nucleus, the wall, everything. You can also see bacteria and parasites on a stain. They still use this in stains to look at slides in pathology. So they also were able to identify the malaria parasite on there. This is back in the 1860s when malaria was killing a bunch of people, which it still does. But in any event, the other thing they noticed, besides identifying the malaria parasite, it killed the malaria parasite. So it became really hydroxychloroquine. Became the first kind of drug out there that was used to kill parasites. But it also has antibacterial, antiviral properties. The most, I guess, well-known FDA-approved use for it is for methemoglobinemia, when somebody has an overdose of carbon monoxide or cyanide. And if you go in the ER with those, you're still living, then they're going to inject your vein with it, and it's going to save your life. So every ER doc knows where it's located. But we learned to use a lot. It came into vogue really during COVID when people were struggling breathing. So it definitely helps deliver oxygen to the tissues better. And it seems to give you focus. We use it a lot for brain health. I put a lot of people on methylene blue.
Yeah, it's almost, it's like a,
gives you energy, helps you breathe better, helps you focus. We use it for preventive measures for UTIs and women with recurrent UTIs. It'll turn your urine blue. So that's kind of what it does. And the NeuroPro Plus has vitamin C in it, because you really need vitamin C to kind of potentiate it. So try it. I think you'll probably like it.
I take it for my immune system.
Yeah.
Like whenever I'm feeling like a little sniffly, I'll double up on it, and it always helps me. Foxy Moxie, I hope that helps a little bit. Thank you for the question here. I'm gonna oh, this is great from Karen. Self-employed, we use Farm Bureau. High deductible benefits of self-employed. Covers very basic medical. That's awesome. Thank you, Karen.
That's exactly Farm. I meant to say Farm Bureau.
Farm Bureau.
Yep. Farmers Insurance. Farm Bureau.
UMR plan. Thank you, Karen, for that. Thank you, Foxy Moxie. Okay, we're going to keep moving. Thank you guys for the kind questions and comments. Real quick, let's see, where are we at? Welcome all the first timers here. If I can find a question, I know they're out there. A lot of them are about the weather.
Weather?
Because I'm bundled up over here. Let's see. Okay, Foxy Moxie. Real quick, while we have quite a few. If you're a regular of the show, you might have seen the comment from D. Lynn about her husband passing. Please put D. Lynn and her family in your prayers. She's with us tonight. She's with us every single week. And real quick, I do want to say, D. Lynn, send me an email if you. I don't know if you've taken the stress relief or not, but I know this is most likely a very stressful time for you. I'll send you a stress relief on me. Send me an email just to send me your address if you're with me tonight. Let's go to Vicky here. My daughter is going to have a complete hysterectomy in December. She has heard that in lieu of hormones, there are some natural supplements or compounds that one can take prior to surgery that will help with the hormone adjustment. She has heard that some have a difficult time after surgery and would like to have something to help. She can come in for a consult if necessary. What's your thoughts on this for Vicky's daughter?
Yeah, well, I'd like to know how old your daughter is and what the reason for the hysterectomy is. But in any event, a lot of, my favorite natural substance for menopause, which it'll throw her into an immediate menopause, so that she needs to begin treatment in the hospital, in my opinion. But beforehand, you can use something like evening primrose oil, which may kind of prime it a little bit. But after they take those ovaries out, she's going to go into immediate menopause with the symptoms of hot flashes, night sweats, etc. So I would start her out on bioidentical hormones ASAP, as soon as she got out of the hospital, or in the hospital, if possible. I don't know if the surgeon is familiar with bioidentical hormones, but a lot of times they'll just put you on estradiol patch. That's the most common thing they would do, which is fine. It is a bioidentical hormone. A lot of women don't like the patches because it breaks a lot of them out. And you're also going to need progesterone, even though you don't have a uterus, in my opinion, and also testosterone most likely. But yeah, that's going to be something she really needs to talk about And again, I want to know the reason for the hysterectomy as well.
And I see here, Vicki, your daughter's in here. Johanna, I believe, is your daughter. If I have that correct, if I do have that correct, Johanna, you have an amazing mom with you tonight. Shout out to Vicki and all the moms out there. So I hope I got this right, Johanna. I'm 38, having a total hysterectomy in December. What do you suggest for hormone replacement after surgery?
Bioidentical hormones.
And you need more context for Johanna. Let's see if we can get it. Johanna, can you give us a little more context, and hopefully we can help more? Okay, let's get to see. We got Kay here. I'm looking for Johanna's comment as well. What can I do for a mild case of diverticulitis? Is there a special diet?
Yeah, bland diet. Or just give your bowels a rest. My dad, who was a colon surgeon, always told me that any kind of abdominal pain, don't eat. Just clear liquids, advancing slowly to a very banal type of diet where like it's called a brat diet, where you just eat bananas, rice, and that type of thing. I forget what else, applesauce. But if you have diverticulitis, you probably need to hit it with an antibiotic. Usually, if you have a pretty good case of it, we hit you with 2 antibiotics, and they're heavy hitters. You got to worry about, you still have to take probiotics because you hit it with antibiotics, and they're going to kind of wipe out a lot of the good bacteria in your gut too. So I'd say on a really bland diet, or stop eating for a day or two. And then you probably, you just don't want this diverticuli to get worse, because when they rupture, you can actually have to go in there and emergently, do a bowel resection, which is not good. A lot of it depends on if you're bleeding, if you're running fever with it, but people get pretty sick with diverticulitis. Diverticulosis is just a medical condition that affects probably 50% of adults, where you just have these pouches that can become inflamed and infected. You can have pain on the right or left side. Probably more commonly on the left side. That's why they used to call it left-sided appendicitis. Your appendix is on the right side. But so I'd say a bland diet. I've had people that get over it just going on a bland diet and not having to get on antibiotics. But if it gets bad, you need some antibiotics. Don't let it get out of hand.
Kay, thank you for that question. I hope that helps a little bit. Let's get to Kathy here. I know I skipped over Kathy a minute ago. What do you think about the spike detox protocols like nattokinase, turmeric, and bromelain for long COVID, especially for those with high COVID antibody levels, which they say reflects spike protein level? Do you think having a high 15K level is a concern?
Yeah, I would definitely take the Dr. McCullough's protocol, which you're talking about, the spike detox protocol, for sure. Again, COVID can cause long COVID, but that spike detox protocol is mostly written for people that took the vaccine. And I have a lot of people that have gone on that detox protocol and improved. Do you know anybody that took that vaccine that's happy they took it? Have you met anybody yet?
Mm-mm.
I don't think I have either. I've questioned a lot of people about it.
Yeah.
But yeah, and again, you're one that might want to get on low-dose naltrexone, which is my favorite long COVID medicine. Methylene blue is great too. And some of the other things like the nattokinase, turmeric, bromelain also help a lot. But yeah, there's a lot of other things we'll do depending on the symptoms, whether it got your GI tract, your
she
brain,
is unvaxxed.
heart.
Kathy's unvaxxed.
Thank goodness. Good.
Okay, Kathy, does that help? That's a great question. We get a lot of questions around that spike protein protocol. I'm going to put this up from Johanna, a little context. Yes, I'm 38, have uterine fibroids that are not able to be removed due to being deep into the uterine walls and a history of cysts on the ovaries. Does that help you with some thoughts? Okay.
Yeah.
Okay.
So you're going to take both out. You need hormone replacement with bioidentical hormones.
Johanna, thank you so much.
Good luck with that.
Yes.
It'll do fine.
Yes, we're thinking about you. All right, let's get moving. I'm going to go to Ron. I see Ron's got a question. I'll get to Mama T. And I love this because Ron's so honest. I'm sure you're getting this too in the office. I was just reading on ChatGPT. I was just reading on ChatGPT that the estradiol patch was good for systemic benefits and the cream is good for more vaginal benefits. Would it be best to use both the patch and the cream?
Yeah, in a lot of cases, especially for vaginal dryness, you got to remember when you put it on the skin, you get systemic absorption with it. So yeah, definitely is a good thing to do. I usually like estriol cream. I think that's the one that brings the most relief and is definitely safe as all get out. And once your other hormones get going, you probably won't even need the cream, vaginal cream, too much. But good question. That reminded me of you talking about ChatGPT, which is AI, right?
That's AI. Yeah.
Somebody asked me today, does AI have common sense? I didn't know how to answer that. I call myself the Common Sense MD. Does AI have common sense?
I mean, you could argue that AI has the most common sense, but also it's pulling from all these different sources. So it's hard to say.
Let's take a vote. I would say no.
I would say,
let's take a vote. Does AI have common sense? Yay or nay?
I would say it's really important for the person who is using the AI to have a lot of common sense, which would make the AI have a lot of common sense. My thoughts.
I like that explanation.
Let's get to Linda here. I'm 78, been taking Premarin 0.3 milligrams every day, progesterone 2.5 every other day since in my 40s, synthetic, no hysterectomy. And I don't know if there's a question here, Linda, but I appreciate this comment because we talk a lot about Premarin and Prempro, and for some people it does seem to work really well. Is there any
I would use Premarin over nothing.
Yeah.
There's no doubt I would.
Yeah.
I mean, again, we tend to use the estradiol, but Premarin is obtained from pregnant horse urine. But even in the studies, even in the WHI study, they use Premarin and Prempro. The ladies on Premarin had less breast cancer than the ladies with nothing. The patients that took Prempro, which you have to take if you have a uterus, their incidence of breast cancer went from 4 per thousand to 5 per thousand. And they called that a 25% increase in breast cancer with hormones, which is totally misleading. And half the women in that study were smokers. Yeah. So it's a terrible thing. The one thing I would tell you is please make sure you're probably taking medroxyprogesterone, which I don't like. That was a bad actor in that. So I would switch over to a micronized progesterone. But again, that's what we used to do. And that's, it's a low dose of Premarin and, just kind of an average dose of progesterone. But I'd probably, if you do anything, switch over to a micronized progesterone, just safer. But you're probably doing better than women that took nothing.
Linda, thank you for that comment. I hope that helps a little bit. Real quick, I'm going to see, I saw a question out. There we go. I want to get to this from Chuck. Chuck, so good to see you. Thank you for being here. I had a DEXA scan last week, and one of the pre-scan questions was, am I taking HRT? When I got the scan, the guy asked if I was sure that I was taking HRT. Why were they asking? What's your thoughts on this?
Well, they could have been asking for several reasons, because people that are on HRT have a better DEXA scan. Maybe they're doing their own little, just curious, want to know. It's funny because I've had a couple people get mammograms, and when they heard they were taking HRT, any kind of hormone, they says, "Oh my God, get off of that." It's just terrible advice. The technician should not be giving you any kind of medical advice, believe me, because they totally got it wrong there. But so probably just want to know, you probably have, if you've been on it, HRT, you probably have a way better DEXA scan than if you weren't. There's no doubt about it. Unless they think they know something and they want to preach to you, but probably just for their own benefit. And, that's just, the more information you get with patients, the better medical care is. So hopefully you told them you were on HRT, and they would say, good for you. You got a good DEXA scan.
Chuck, thank you so much for that question. It's a great question. I
Also,
want to know too.
Also, probably with men, they want to know about testosterone. Of course, that's hormone replacement therapy in men. Excuse me. So it's recommended that men with low T get a DEXA scan, just to see if they have bone loss from low T.
Yeah.
I mean, it's not just women to get these DEXA scans. I've had one, and it's men too. So if you have low T, you're more likely to have osteoporosis, osteopenia, which men can get too, just not nearly as often as women. So that's probably why they ask you that. They wanted to know why a man would be in there getting a bone scan.
Interesting.
Because he has low T.
Interesting.
They just want to, but yes, interesting. Yeah.
Chuck, thank you for that question. Thank you for being here. Let's get this from Diane. Ideal testosterone level for women on hormone replacement therapy?
That just varies a whole lot. There's no normal for women's testosterone levels. If you look on the lab, it'll say 0 to 45, and which is ridiculous. I mean, you really, I'd say ideal is more like 80, 100, 150 maybe. You just need to see if you get too high as a woman, you may get hair growth or acne. And if you are one that should not take estrogen because you had an estrogen sensitive breast cancer, then you've got to make sure that testosterone is not aromatizing to estrogen. So keep a close eye on it with that. But I would say 80 is probably average that women like. But again, I don't go by just lab values. I go by how you feel. And testosterone is the one hormone of all that's going to make you feel the best.
Diane, thank you for that question. It's a great question.
It's funny because I'll tell you a story. I had a new patient a couple of months ago, and he came to me for low T, and it was technically within normal limits, because for a man, normal could be anywhere from 250, 300 to 1100. That's normal. Certainly not optimal. But so his doctor, I think he was at 350, which is technically normal. So his doctor wouldn't treat him. And he says, well, but if you want treatment, go to Dr. Rogers. He gives it out like candy. I laughed and said, he's right. I do give it out like candy. The only difference is testosterone is good for you. Candy is not good for you.
That's
you know
great.
what you're doing. But I consider it a compliment, really.
That's great.
He sent me the patients.
Let's get to John here on YouTube. Thank you, John. Is there a problem taking GABA if you're taking lisinopril for high blood pressure?
I don't think so. I don't see a contraindication of that. You could always, if you change anything or start any new supplement medicine, just monitor yourself and see how you feel. If you think it's going to lower your blood pressure too much because it relaxes you, then you may be able to titrate down a little bit. But lisinopril is not my favorite blood pressure medicine anymore. I never use it anymore. About 30% of people get a chronic dry cough with it. And a minority of people, the first time they take it, or maybe the second or third, they get this terrible condition called angioedema. It's usually located around the face and causes massive swelling, in the case where you have to go to the ER and in some cases be intubated. Every anesthesiologist has intubated somebody with a reaction to lisinopril. ER docs too. I guarantee you. So we got much better choices out there now with the ARBs, like the losartan, irbesartan type medicine. So I do not like lisinopril. If somebody's been on it for years and they found, okay, keep taking it. But yeah, I just never start anybody on it anymore.
Interesting. John, thank you for that question. Real quick, I can't see the name. This is over there on LinkedIn. I was gonna want to give you a shout out. This is amazing. Thank you for this kind comment. And the question is, what about Sustanon for HRT in men over 40?
Yeah, Sustanon is a combination of the 3 types of testosterone. Short acting, immediate acting, and ultra decanate, which is long acting. It's not legal in America yet. It is legal in Europe. It's not a bad thing. You just can't get it legally because I can't prescribe it, but I know people do take it. So it's not a bad combination as long as you kind of stay on low doses, because it's a lot more potent than testosterone cypionate or nanthate. It has propionate, undecanate in it. It's a heavy hitter. Just can't get it legally here.
Thank you for being with us over there on LinkedIn. I see Jill Henritzi is over here from our Bristol office, our PA. Thank you so much for being here. Denise DePriest is in here. Shout out to Denise.
Wow, we got some heavy hitters.
So good to see you guys.
We better be on our toes.
I know, we got to be.
Man, I'm getting nervous.
Guys, don't ask us the tough questions.
Ask Jill the tough questions.
That's right. That's right.
Jill
can answer them in the comments. Okay, Smokey Mac, I'm trying to get your question here. Okay, here we go. Methylene blue. Will it help with someone that has COPD and a CO2 retainer?
Yeah, I've used it for that a lot. I don't think it's going to hurt you. The only possible question that people may have for it is if they have a G6PD deficiency, and they use huge doses of methylene blue. They got to be cautious, but I just don't have anybody that gets on that massive a dose. So if you're on an MAO inhibitor, and there may be a contraindication for it, but we just don't use MAO inhibitors much anymore. Those are old-timey kind of psych medicines that you can't eat cheese with or drink alcohol. You'll have a major reaction if you do. So, but yeah, I would definitely try it. I always start out low, go slow, and see if it does help you.
Smokey Mac, thank you for that. I hope that
definitely
helps.
delivers oxygen to the tissues better. So
yeah, I hope that helps a little bit. Thank you for the question. I'm going to get this real quick from Jim and Teresa. I had the Cleveland blood panel done, found out I make too much iron, and I think the number is 467. I don't use iron pans or take a supplement. How often should I donate blood to help with this?
Yeah.
It seems the iron level is 467.
Yeah, it's a little high. But it just depends. Once a month until you get it down, then go to 2 months, maybe 3 months. You have to just keep an eye on it and titrate it to a hematocrit and a ferritin level that's, decent, when you're not too weak too. So I've seen people with this. It's called hemochromatosis. It's usually genetic. Sometimes we even check the genetic test for this to see if you have it. So definitely don't take any supplements that have iron in it. You're one that probably should not eat beef liver either. A lot of iron in that. But I probably would not restrict my intake of red meat, which is good for you in most ways. You'd have to eat a lot of it to saturate that. But so it just depends. Start out at maybe once a month and then taper off a little bit. You may have to do it eventually twice a year.
Jim and Teresa, thank you for being with us tonight. I hope that helps a little bit. I'm going to get to Melissa here. Recently found out about having the MTHFR gene mutation. Do you recommend doing a cleanse, detox, or anything specific for that?
Yeah, again, it's not a huge deal to have a gene mutation. At least 30% of us do. I have 2 myself of the ones you don't want. Again, there's a 677T and there's a 1298C. You can have the T or the C on either end. Remember, you get 1 gene from mom, 1 from dad. So if you have both copies of the 677T, like I do, it can predispose you for things like blood clotting, miscarriages, heart disease. But the key to it is realizing that you're not a good methylator and that you need to replace you need to replace your vitamins with methylated vitamins. And what I do for that is, number one, check the homocysteine level, which is a marker that's an inflammatory marker for how bad it is. You want to get your homocysteine level down 10 or below. And to do that, you take methyl B12, methylfolate, vitamin B6, and a lot of times I'll add trimethylglycine on it. So I'll take all those and my homocysteine level is down. I also take a baby aspirin. I've been doing that for 30 years, and it's very helpful for that condition as well. The 1298 mutation is not responsible for any blood clotting, heart disease, anything like that. The only correlation I've ever seen with that is people that have the 1298 mutation tend to have more psych problems, anxiety, depression, that type of thing. So, and one thing about it, if you do have this HFR gene mutation, never take folic acid, take methylfolate. That's the active form of vitamin B9 that's so important for your brain. It kills me to see these pregnant women getting on folic acid when a lot of them really need methylfolate to prevent neural tube defects in their babies. So just take methylfolate. That all has to do with that homocysteine going to methionine cycle that, if you've ever looked at the Krebs cycle in biochemistry, it goes way back to college. This stuff makes a difference. So see what gene you have, look at your homocysteine level, get on methylated B vitamins, maybe some TMG if your homocysteine level still persists to be high.
Melissa, thank you for that. Great question there. I want to get to Donna real quick. What is your opinion on ivermectin for colon cancer?
Yeah, I like it. I do. I use that and fenbendazole for colon cancer patients. I recommend, because I'm more of a blend traditional and alternative, that with, getting the traditional stuff too, get your, I'm sure you've already had surgery to get that out, but depending on metastasis and stage of your cancer, I would definitely get on ivermectin. There's no doubt in my mind I would. I'll take it prophylactically anyway. I also take an 81 milligram aspirin I was just talking about, which cuts down your risk of colon cancer by 30%, maybe more. So, it's a very, very useful thing. Ivermectin is a hugely advantageous medicine to take.
Yeah.
And in Tennessee, it's over the counter now. Look what it did for COVID. It saved so many lives. It worked. Don't care what they say, it worked. Saw it many times.
Donna, thank you for that question. I see you, Real Anesthesia. Great to see you. Cabron, what's going on? Charles, what's up? Celeste, hello. Great to see you. We're looking over here as well, guys. I'm going to get to see Sandy's asking. I'm currently taking testosterone cream 1 milligram. I'm having some hair thinning. My DHT level was 12. What should I do? Female.
Yeah, that's not a high DHT level. So you're not really getting a lot of conversion of testosterone to dihydrotestosterone, which is the form of testosterone, the hormone that causes two things. One, enlarged prostate, two, hair loss. So, it depends on, if you start taking it and you feel great, keep taking it, but you probably need to add a couple things, 3 things really. And I did a podcast on hair loss a couple weeks ago.
Yep.
Finasteride, which is a prescription form of a DHT blocker, especially if saw palmetto is not working for you, which is a more natural thing, natural DHT blocker. Minoxidil orally, which is Rogaine orally, works better than the topical and makes more sense, easier. And Happy Healthy Hair Vitamin, which I think really helps hair loss. Now, I saw a report, there's been several reports I've seen in the last couple of weeks where stevia extract can help reverse hair loss.
Really?
One thing, yeah.
Like the sweetener?
Yeah. Well, I'm going to dive into it, but there's already companies coming out with formulations for it. But just interesting stuff. And of course, if you are hair thinning. Remember, hair loves estrogen. It really is not real fond of testosterone. So you always have to weigh the risks versus the benefits. If you have that genetic tendency to get thin hair, man or woman, then you need to take the appropriate measures to prevent it. It's easy to regrow hair in women. Not as easy in men, but doable for sure, as you saw on my podcast, which is really more focused on men this time than women. But always check your thyroid, check your iron levels, make sure metabolically nothing else is going on. But if it's a direct correlation of when you started the T cream, which is a low dose that you're taking, then stop it for a month and see if, don't do anything else and see if it helps. You may be one that just needs to take a little DHEA, which in women is a precursor and will bump your T levels up.
Sandy, thank you for that question. I hope that helps a little bit. Real quick, I see Ashton Williams is in here. And Ashton recorded an episode of the Common Sense MD last night with Doc, and it was fantastic. I was behind the camera and talking all about menopause treatment and new things that are coming out around menopause and hormone therapy for women. So stay tuned. That's going to be out, I believe, in 2 weeks or so. And Ashton's seeing patients in Kingsport, Johnson City.
Ashton has a lot of common sense.
She has a lot of common sense. And
Yeah,
that came out in the episode last night. Ashton did amazing. I'm so excited for that episode to come out.
She's good on camera.
Great on camera.
She was a news anchor woman for years.
It's unbelievable.
Then became a nurse practitioner.
And you guys got into
Found her calling.
a little bit of that story. She has an amazing story. I hope you guys watch that episode. It'll be out in a couple weeks. You'll get to know Ashton a little bit better. So Ashton, thank you for being with us tonight. Real quick from LinkedIn, what's your opinion on the carnivore diet?
I love it. I love the carnivore diet. I know Jake likes it.
Jake definitely.
That's why I have a carnivore hat on. I love it.
This is essentially a carnivore hat.
A lot of times when I have a person with a lot of gut problems or really any autoimmune disease, I had one today, told her to get on a carnivore diet. It's definitely, and again, you need the grass-fed, no pesticide, Brookside or Brookhaven type meats, but tremendous advantage to carnivore diet. I mean, it may bump your cholesterol up a little bit. So what? It's really more the insulin resistance that causes heart disease and problems. It's not really cholesterol. So it's an interesting take. A lot of people I put on the carnivore and their cholesterol and lipids actually look way better. Some of them, it goes up. But did you see where RFK is a proponent of more saturated fats?
No, I didn't. When did that come out?
This week. Yeah.
This week?
Yeah, which is great.
Yeah.
Saturated fats are not the demon that everybody thinks. Some saturated fats are trans fats, but
I was trying to think. I was talking to, I was recording with Bo McGregor, our nurse practitioner in the North Knoxville office. And we were talking a little bit about saturated fats and just, a lot of the misunderstanding. Anyways, that's going to come out here soon as well. So
Bo has a lot of common sense.
He has a lot of common sense.
Smart too.
I'm going to get to Kathy here. Kathy, thank you for being patient with me. Is there a test for dementia or other memory loss?
Yeah. There's plenty of quizzes out there that we use. We have them in the office. A series of questions. So really a 30 question test, and it includes a lot of simple questions. And one of them is to draw. One of the most common ones is to draw a clock face I'll have patients draw me a clock, and I'll put the hands at 2 p.m. And if they can do that, and it's not real small or scraggly, I'm a lot less worried.
That's interesting.
But then I'll also ask them, do some memory tests with them to try to, have them do some recall for me on some words I give them and things like that. So yeah, there's certainly a pretty good quiz that you can do really in about 10 minutes.
Interesting.
For dementia.
Kathy, thank you for that question. Real quick, I'm going to put this up from the LinkedIn. In regards to the carnivore diet, I ended up having some negative liver profiles because of it. It did help my gut issues and lost a ton of fat because of it. But also lost muscle. Interesting. Very interesting.
Interesting. Wow, you lost muscle eating all the protein.
Huh.
Lost a ton of fat. That's interesting.
You're definitely gonna. I've noticed a lot of people lose weight on a carnivore diet. Haven't heard the muscle part, but everyone's a tad bit different. So
Everybody has to work out too, and
Yeah.
definitely take creatine. I think every adult should take creatine, which helps preserve muscle. Especially people that are on GLP-1s, they need to take creatine.
I see Diane has a GLP-1 question. I'll get to that in just a second. I'm going to get to Mama T here. In regards to pellets, I have heard numerous people say that they were overdosed on testosterone and underdosed on estrogen. How does your office prevent that?
Well, we check labs. We're very cautious, conservative at first, and bump it up. When I'm first putting the pellet in, I always get levels before, and we start out at fairly low doses. But it's easy to reverse if your estrogen level, because I just pop up the progesterone. Testosterone pellet, knock on wood, I've never had to take a pellet out of anybody. But testosterone, you could do some things to kind of bring that down too. But sometimes it just has to wear off. But just being cautious, checking labs, listening to patient symptoms and that type of thing. You don't want to overdose anybody on any hormone or medicine or vitamin or anything.
Yeah,
it's certainly possible. So caution, start low, go slow is the policy.
Mama T, thank you for the question and letting us talk about that. I'm going to get to Diane has a GLP-1 question I think will help a lot of people. GLP-1's not covered by insurance. What's another option? And I know you get this question every day in the office.
Yeah, we're able to get a compounded form of the GLPs. They have to make it a little bit different, and it has to be really for a different reason that we use it. Like the many other things we use the GLP-1s and GIPs. For example, I take a microdose of tirzepatide myself, not for weight loss or diabetes. I take it for inflammation. But it's also very cardioprotective. It's brain protective. It is an anti-inflammatory. So the compounded versions have been real effective. It's a shame that insurance won't pay for them because they're overpriced for sure. Even the compounded forms aren't cheap. A lot of the pharmacies make the oral forms of it. I just haven't found them to be that effective yet. But they'll come out. They're going to come out with some new stuff, and there's going to be competition, so the price is going to come down.
Yeah.
But if you definitely just can't afford it, then I call berberine, Nature's Ozempic. It's not going to be as potent as a GLP-1, but it's a good place to start for if you have insulin resistance. But yeah, it's a tough gig. They used to be just cover it. Now it's like pulling teeth to get it covered.
Yeah.
They just won't do it unless you're diabetic.
Diane, thank you for that question, letting us talk a little bit about that. I want to get to Lisa here. Lisa, thank you for being here as always. Doc, I retained some fluid for about 6 weeks and couldn't move it. My nephrologist changed my meds to 100 torsemide, spironolactone 50, and metalazone for 3 days. Metalazone. I have lost 23 pounds due to a fluid. However, I'm suffering with severe painful cramps all over my body, even in my bones. Is there anything I can do that'll get me some relief from these painful cramps? Lisa, we're thinking about you. Anything that Lisa can do for us?
Torsemide is a kind of a more potent form of diuretic than Lasix is for most people. And you can lose potassium and sodium with that, which may be responsible for cramps. Spironolactone is a potassium sparing diuretic, so you have to be careful about that. When you add the metolazone for it, who knows what's going to happen? So you need your electrolytes checked. You need to go in there and get your electrolytes checked. The one thing I would suggest before you do that, before we put you on any potassium or sodium, get that checked. You can get it checked easy for dirt cheap. But you may try some magnesium as well. Magnesium is great for those cramps.
Lisa, thank you for
glad you got the fluid off of you, but man, what an ordeal.
Lisa, let us know if that helps. It's a great question. Thank you for being here as always. Let's get to Jessica real quick. I tried testosterone, but it made me feel rage like I've never experienced before. It was the lowest compounded dose offered. Can some women just not tolerate this? Tolerate it? Have you seen something like this?
Welcome to feeling like a man. We're enraged all the time. I'm kidding. It's interesting because I have seen that probably a handful of times. As many years as I've been doing this, I've seen that in a handful of women and maybe one or two men. People react differently to hormones for sure. What I would suggest is you don't do it and you take some DHEA. So who knows? I mean, you could be on edge for other reasons, stress, lack of sleep, other hormonal imbalances. Progesterone is like a woman's Valium. It calms them down. And most women that I see are deficient in progesterone.
Interesting.
So that may really help it a lot. But if you took the lowest dose and just, were enraged, don't take it. Try some DHEA. Probably as a woman wouldn't go over 15 milligrams of it.
Of DHEA?
Yeah.
Okay.
Yeah. Which can also cause hair loss in women if you get too high on it. But you also may want to check, of course, your other hormones, check the levels and check your cortisol level as well. That's something that can be avoided and we can kind of, work around it for sure. But I have seen that.
Jessica, thank you for this question. It's something that, we don't get to talk a ton about. So thank you for the question. I hope that helps a little bit. Real quick, we're almost out of time here. I know I've missed a few, I believe, but real quick, I see Jeff's in here. Jeff, we love you, man. Thank you for being here as always. Let's see. Dave's got a great question around what's the last song you play on guitar? Because you were mentioning last night. It's been a long time.
I have not played my guitar.
Are you losing your calluses?
My calluses are gone. I've had so much other stuff I've been doing, like a lot of pickleball. I'm now an official
Padel
instructor.
Padel instructor.
This comes from Italy. It's not paddle, it's padel.
We haven't gotten any Padel questions tonight.
Yeah. What is a padel?
Where's our Padel
It's Italian
questions?
for paddle, which you use in pickleball, not a racket, a paddle. So I've become quite gifted and talented on the pickleball court, as you've seen. I beat him like a drum. So the last song I played on my guitar, was probably Norwegian Wood by the Beatles. That's my old standby. I'll hit Stairway to Heaven sometimes. I'll hit, what is...
Every once in a while you'll dabble with Purple Rain.
I will.
No.
Some Neil Young songs. I've done that. I've done that.
Oh, I'm seeing a few questions coming. I want to make sure I get to these real quick. Thank you, Dave, for that. I see you, Carter. Thank you so much. There we go. Look at that. Thank you, Carter. I love you. Let's get to Michael here.
Hey, speaking of Jeff, I'm going to Jeff's party next Monday.
Really?
At the Bristol Motor Speedway.
Rock on.
He's running for re-election.
Yes.
We'll be there to support him.
Yes.
Going to all wear our shirts.
I love it.
He's the best sheriff we've ever had.
Best ever. Jeff, we love you, man. Thank you for being here tonight. Let's get to this question here from Michael. Thank you. And I see Amanda as well. You posted the other day about modafinil. Michael's referring to the Common Sense MDL modafinil. Can you elaborate a little bit? I really struggle with brain fog.
Yeah. Modafinil turns out, it's been around for years in the form of Provigil. Now we have a generic form of modafinil, which is actually affordable if you go to the right pharmacy and use GoodRx. But it is, I don't like to call it a stimulant like Adderall, but it is definitely an energizer. I don't even think anybody knows exactly how it works, even if they say they do. I don't think they do. But the indications are, of course, for shift worker syndrome and narcolepsy, where people just fall asleep. And there's a new form of it out that's actually added a third indication, and that's for sleep apnea-induced fatigue, daytime fatigue. And it just kind of, and I've tried it before, and it really is. It's like drinking a pot of coffee without any of the side effects. There's really no jitteriness or anything to it, but
Can you get
it just
addicted to
kind of
it?
keep you. Not really. No, it's not. I've never seen anybody get addicted because it made you feel better, more clear. But what I've done in the past when I'm studying for boards or something, I've used small doses of it. And it really does seem to help make you more alert. Certainly, if you're falling asleep during the day, have sleep apnea, have to work shifts, and are chronically tired, nothing else is going on with you. Man, it's just a great add-on. Especially, I put dementia patients on it. I've put patients with ADHD that didn't want to take Adderall, or I thought maybe it's definitely a little milder than Adderall. But yeah, it's a great medicine that's not a lot of people even know about. That's why I did a podcast on it. But for anybody that does longevity like I do, in adult medicine, it can be a good add-on. It really can.
Is it something you stay on, or like you do with like your boards? Is it like in
You
spurts?
can, but it's better with any medicine to take breaks from it.
Yeah.
And you can use a PRN. It's a great medicine. It really is.
It seems that Michael is all over the place. An entrepreneur, can't get past the brain fog. It seems like this might be
Most of the people that I have on this are doctors, lawyers, engineers, professors, entrepreneurs like yourself, who multitaskers.
Kyle, after that episode, Kyle immediately texted me, should I be on this?
Maybe
Michael, thank you for
try
that.
it out. Try it out.
I know I'm missing a few. I want to make sure we get to a couple more, and then we're going to call it a night. We'll make sure we get to the ones I miss. Is Peptide Crafters a good place to buy peptides? Have you heard of Peptide Crafters?
Yeah, I have. I saw one of their little ads today. I think they have a pretty good reputation. I've asked around about them. I haven't used any of theirs. I use Peptide Sciences personally, and I like them, and so I trust them. But I've heard good things about Peptide Crafters. I'm not sure price-wise how they compare to Peptide Sciences, but check it out.
Thank you, Amanda, for that. Peptide Crafters, I'm going to look into that as well. Jessica's asking, what would cause an ANA to be negative in July but positive in October? Also was placed on spironolactone due to leg swelling and is doing absolutely nothing. Interesting.
It's not a real potent diuretic. You may need something like Lasix, or better yet, find out why your leg's swelling. But yeah, ANAs are notoriously inaccurate, false positives, false negatives. So unless it's really high, and you can follow them, that doesn't surprise me at all that you could have a negative one. You may have had some kind of inflammation going on at the time, but notoriously, there are a lot of false positives on that, unless it's really high and you have a lot of other symptoms of lupus. A lot of times rheumatologists won't even see you because you have a positive ANA.
Yeah. Jessica, thank you for that. And last one here from Connie. Can the MTHFR gene mutation cause severe depression?
You'd be more predisposed to have it if you have the 1298C gene mutation, but it's not, as correlated with that as you would think, in my opinion.
Connie, thank you for that. Guys, we're going to call it an evening. Let me know in the comments how we did. Let me know how we did. I see. Thank you, Jessica, for that. Thank you, Mama T. Thank you so much. I'm going to turn off the podcaster here. If you guys want to catch a recap of the show, we put this up on the Performance Medicine TV podcast on Apple and Spotify. You can check out that full episode. I thought you did great.
I thought you did.
Although you botched the guitar question.
Yeah,
you didn't have a good answer for that.
Yeah, because I can't think of the last time I played.
You did, and Dave even had a follow-up. I can't.
Dave's a maestro on the guitar.
He had a follow-up, and I can't find it. Well, okay. Well, we'll have to go back and see. You gotta get back to practicing. It's good for your brain too.
I'm going to.
It's good for your brain.
Yeah, I'm going to.
Guys, let us know in the comments how we did. We'll be back. We do this every single Tuesday, 7 to 8. Me and my dad, me and Dr. Rogers answering health and wellness questions. Y'all make this show great. Thank you so much. Again, if D-Lynn's still with me, know that I'm thinking about you. Thank you so much for being here tonight, and shoot me an email. I want to make sure you get a stress relief. All right. Thank you, Danny. Thank you, Michael. We love you guys, and we are out. I'm just looking for my outro. Bob, thank you, man. Love you.
Thank you.
Don't go